Greetings and welcome to the lecture for Chapter 1 in Ethics. This lecture is kind of an introductory lecture. We're just going to do a quick review of what we're going to be covering throughout the chapter. One saying that is in the field of ethics is, "I expect to pass through the world but once. Any good, therefore, that I can do, or any kindness that I can show to any creature, let me do it now. Let me not defer it, for I shall not pass this way again." And so the key here is any good I can do. So a lot of times this can be very challenging in the field of ethics because in the field of counseling with ethics, because sometimes it can be subjective, where a therapist or counselor may feel like that something that they are doing is for the well-being of the client, and then it may not always be what we're doing is for the well-being of the client. It should always be that what we're doing is for the well-being of the client, but there are some cases where what we're going to talk about this semester, there are gray areas. And then there's some cases where things should just not happen in the field of counseling. Some case studies that we're going to talk about this semester is the Tuskegee study of syphilis with the Tuskegee Airmen, 1932 to 72, the Military Tribunal for War Crimes in 1946, the Nuremberg trials, which is where we have our International Code of Medical Ethics that came out of. In 1954, the first kidney transplant. There was a lot of ethical questions about organ donorship, and then also the aspect of the soul as it relates to our physicality and bodies. And then the 1960s, cardiopulmonary resuscitation, or CPR, where someone has the right to have a DNR, do not resuscitate, on their chart if they're in the hospital. Okay, so what are ethics? Ethics are a system of moral principles, the ethics of a culture, a society, the rules of conduct recognized in a respect to a particular class of human actions. If it's a group, a certain group of people is going to have a ethical guideline or a set of ethics to go by. The social workers have their own code of ethics, family therapists have their own code of ethics, professional counselors, and then of course through DSHS LCDCs. Moral principles, as an individual, his ethics forbade betrayal of a confidence, or confidentiality is a part of ethics. They're at the root of ethics. And then that branch of philosophy dealing with values relating to human conduct with respect to rightness and wrongness of certain actions and the goodness and badness of motives of ends of such actions. So basically it tells us how to interact in certain settings, in certain places, and should guide us in what we do. Everyone has a set of belief systems in their life, which can also be known as values or beliefs, and those values and beliefs would be that person's individual ethics. Ethics are also the manner in which a professional relates to clients, colleagues and supervisors, and the general public. This is where we look at linking professionalism and ethics, doing right with other people in the field, or encouraging others to also keep the client well-being at center. Not a necessary evil is relational in nature, developmental, and involves contextual factors such as organization, law, and culture. So here's what we're going to talk about. Basically, there is not always an easy set of answers to something. There is a set of ethics to go by, things such as dual relationships, confidentiality, and also what it's talking about here is your ethics are going to evolve. We're going to talk about different levels of ethics in a few chapters, and you will watch yourself grow through these levels of ethics as you go through the field. So it's developmental and evolves. You'll learn a lot in your internships with supervision with other counselors, and then also there are some contextual factors. The organization, which is where you work, they may have something that they are some type of organizational structure or policy that may be seen as unethical, and then also cultural within a culture, or even the law, the words or the set of the law. We're going to look at this as everyone has their own letter of the law, or just the spirit of the law, or just a mix. The letter of the law means something is done 100% accurately according to the legislation or the law or the setup or the actual board ethical standards. And then sometimes it's just a spirit of the law in order to, and we're going to look at that in a couple of chapters as far as non-malfeasance, beneficence, which is do no harm. Actually, also the integrity, and fidelity. We're going to look at all those. The book, A Process by which a person moves from just laws to internalization. And these are the three levels that I was just talking about just a minute ago. And we're going to talk about this more as we go on in further chapters. But you move from just knowing the laws to living the laws to teaching the laws, and you move through these perspectives. So here's the types of ethics. There's general ethics, the study of behavior and decision making. Applied ethics here, ethics meet the world. Professional ethics, professional standards by the field, and so you're going to see that word professional standards in place in a lot of what we do. Organizational is the company or organizational philosophy about ethics, or their oftentimes it's integrated into their mission statement and objectives. And then personal, it's personal view of right and wrong, and that doesn't always line up with what the field or what the organization's belief system is. For example, I use this example in also the counseling theories class, but if you feel that giving someone methadone or giving someone some type of medication to get them off of a drug is a negative thing, then you probably should avoid working in a methadone clinic. Okay, what is a dilemma? Ethical dilemmas is something you will deal with. It's a choice between two rights. A dilemma would be situations encountered where there is a conflict or confusion of personal standards and ethical standards. A dilemma might be the actual law on accepting gifts is not to accept anything over $50 in value, I believe is what the rules say. And we'll talk about this in class. But most agencies, most facilities are stricter than that and will say not to accept any gifts, not even a card. If someone was to give you a Christmas card, that would be seen as unethical from an agency perspective. What the dishes rules say on that, the dishes rules say nothing of value, but what counselors and supervisors that I've worked with have said is if someone hands you a card, no one who's observing that knows what's in that card, so you've already kind of broken the ethical standard because it could be perceived that there's something value in the card because no one else knows. So it just becomes really sticky there. What happens when resources are scarce and only one patient can be treated, and we may not have the resources available to help those, or maybe insurance payers are not paying for certain diagnoses or disorders, or only pay for a certain number of visits, and those visits are not enough visits. So those are always dilemmas. And then also, should age be a determining factor? As far as if someone's elderly at a point where they may not have that many years left to live, does that mean that their life is less valuable, or that they should not receive treatments like we're talking about organ transplants and such? Human cloning is another example, and we're going to talk about some of these in class. What are your ethics conflict with your company's policy? What if the company policy is not to accept new referrals, and there's a need and people are coming and trying to enroll in your facility? Who should get preferential treatment? A 50-year-old habitual substance abuse user, or a teenager who grew up as a crack baby and is addicted to crack? If you had one slot to fill in your agency, how would you make the decision of which of those would get that slot? This is an ethical dilemma. Resolving these ethical dilemmas, you must take into account professional domain, what your professional ethics are, your personal ethical domain, and then the contextual domain, your own personal ethics and cultural ethics. You have to know your own biases that you have as far as your culture, other cultures, anything that you have as far as a personal opinion or personal biases. You need to take those into account and make sure that they are not influencing your professional or ethical domains. Some steps to consider is evaluate sensitivity, your own sensitivity, identify the problem, identify people altered by the decision, identify potential courses of action, look at the benefits and risks, consult with peers or supervisors, or consultation is a key word there, decide on a course of action, and then implement, evaluate, and document. Document, document, document. If you didn't write it down, it didn't happen. So this is just kind of a brief introduction to what we're going to be talking about this next few weeks with introductory ethics. Keep in mind that some key points here from today are ethics are developmental in nature. They will continue to change, and new laws and new issues will come about. A consultation is paramount. In ethics, there's a choice between a rock and a hard place, so it could be from worse to even from bad to worse. It depends on the context of what type of decision you're going to making, and then keep in mind that once you make a decision, you must live with that decision. People make mistakes, but not because they intentionally harm, but because they're ignorant of the laws, unprofessional, apathetic, or careless. Apathetic means that they just don't care one way or the other. If you're a professional, you are likely ethical. And this concludes our first lecture, and I look forward to seeing you in class.